Tonight, Northside Hospital says the Laureate Medical Group offices at the center of last week's mass shooting in Midtown are now making the final preparations to resume care for patients.
Today, we learned two of the women injured in Wednesday's shootings worked for the Laureate Medical Group. Meanwhile, Northside says most of its Midtown facilities are now open. Last week, we told you about violence targeting healthcare workers, and in the wake of this shooting, we are learning the problem is getting worse. Joe Ripley joins us now to explain. Joe?
The Bureau of Labor Statistics tracks violence against healthcare workers. It found after service industry workers, healthcare workers were actually most likely to be injured on the job. Ashley Blackman has 20 years of healthcare experience. She says violence targeting healthcare workers is not new, but it is increasing.
It's terrifying. You are scared for yourself.
Now the president of the United Advanced Practice Registered Nurses of Georgia, Blackman says healthcare workers experience some form of violence nearly every day. She says a patient tried to hit her with medical equipment, and others have reportedly tried to strangle doctors with their own stethoscopes.
Healthcare has always where you meet the patient where they're at their sickest and their weakest, and their family is also at their most emotionally stressed and vulnerable, has always been a volatile place.
A CDC employee and two healthcare workers were among the 5 people shot last week in Atlanta's most recent mass shooting at a Northside Hospital medical facility in Midtown. The suspected gunman is in custody. Blackman says unhealthy coping skills, a lack of adequate mental health care, and stress have all contributed to a rise in violence targeting healthcare workers. The U.S. Bureau of Labor Statistics tracked healthcare as the top private sector for work injuries in 2021. Matt Caseman, CEO of the Georgia Nurses Association, says this comes as an already strained healthcare system deals with dwindling workers.
Some people get very aggravated and just in a bad state of mind. Nurses shouldn't have to deal with this kind of level of assaults.
Last week, Georgia Governor Brian Kemp signed a bill aimed at protecting healthcare workers. It sets stronger penalties for those who assault them and allows hospital systems to form their own police force.
I think it is one piece to say, hey, let's bring awareness by saying this needs to have stronger consequences.
And in addition to lawmakers' efforts to try and curb this violence against healthcare workers, Blackman suggests addressing the social issues, including mental health, that can cause folks to act violently.